Hello, everyone. I'm Charlene Schramm. I'm a program officer at the National Heart, Lung, Blood Institute here at the NIH, and I am one of the members of the NIH team that oversees the Kids First program. I'd like to give you a few program updates, and then you'll shortly be hearing about new opportunities coming up. In the first 4 years of the Kids First program, we selected about 25 projects or cohorts representing approximately 26,000 genomes and an estimate of about 10,000 cases, that is patients affected with a variety of childhood cancers and or structural birth defects. The sequencing of samples from these families are at various stages in the pipeline, with 8 data sets currently released. This summer, we selected 10 cohorts from the 2019 cycle of the EXO-1 opportunity, and EXO-1 refers to the particular mechanism NIH uses that allows investigators to apply to get access to the services of the Kids First Sequencing Center. This includes 7 projects representing conditions that have not yet been sequenced by Kids First, such as CHARD syndrome and rhabdomyosarcoma. And additionally, we've awarded the Broad Institute and Hudson Alpha Institute for Biotechnology, in collaboration with St. Jude, to continue as those sequencing centers for 3 more years. Several of these cohort projects are collaborations that will amplify the impact of the data. For example, we've been able to increase the sequencing of cohorts of children with Down syndrome and congenital heart disease, acute lymphoblastic leukemia, or acute myeloid leukemia. And we've also added a project focused on fetal alcohol syndrome. So this is in collaboration with the INCLUDE project for Down syndrome-related phenotypes and the National Institute of Alcohol Abuse and Alcoholism here at NIH for the fetal alcohol syndrome project. Additionally, several Kids First investigators are working with the Knockout Mouse phenotyping project program, to functionally validate variants that are identified in Kids First data sets, and that program is referred to as COP2, or the Knockout Project. So many of you are interested in knowing which data sets are currently available for access, analysis, and collaboration. These include projects representing disorders of sex development, congenital diaphragmatic hernia, Ewing carcinoma, orofacial clefts, structural heart defects, and cranial innervation disorders in adolescent idiopathic scoliosis. And we've compiled a list of links you can go to learn more about these cohorts and data sets. There is the Data Resource Center, which has created a Studies and Access Support page to describe the data sets you can access through the data resource. There's the Kids First Bioproject page, where you can access the dbGaP study pages, dbGaP being the database of genotype and phenotypes. You can see the dbGaP study pages of each released Kids First data set. And you can read the abstracts of all the EXO-1 cohort projects, even before they're released, on the Kids First Common Fund website. And you can start by accessing clinical and phenotypic data sets through the Kids First Data Resource Portal, as you've seen today in the demo. But in order to access individual level genomic data sets, you will have to submit data access requests through the dbGaP data site. These requests will be reviewed by the Kids First Data Access Committee, which was assembled to streamline an approval process and is run out of the NCI Office of Data Sharing. So I'm going to turn it back over to introduce Danielle.
As we close out the FY19, we complete 5 years of Kids First. So we have started to think about the best ways to accelerate pediatric genomics research for the remaining years of the program. To that end, last fall, we launched a survey at the American Society of Human Genetics meeting to solicit feedback from the Kids First research community. We also held meetings with our steering committee. We met individually with each of our external program consultants. We gathered feedback from the administrative and outreach core of the DRC and brainstormed with the NIH Kids First working group. To that extent, 7 key recommendation themes emerged from the strategic planning exercise. The themes covered supporting innovation through resource, infrastructure, and tool development, supporting clinical and phenotypic data extraction, harmonization and curation, encouraging validation and discovery through collaborative efforts with an emphasis on engaging trainees and new data users, promoting data sharing, and supporting integration and interoperability with other pediatric data sets, as well as pursuing functional validation with model organisms. We are in the process of brainstorming ways to address this feedback, and in the meantime, we will continue sequencing through FY21, and we will continue to develop the data resource. While we think through solutions to address these recommendations, we will accept feedback from the public at any time. So, this slide shows some of our feedback channels that include email. You can email the NIH program, Kids First program email address is kidsfirst@od.nih.gov, or contacting the Kids First Data Resource Center at support@kidsfirst.drc.org. We also encourage you to visit the NIH Common Fund website to learn more about the program and to check out the data resource portal. Now I'll turn it back over to Valerie.
Thank you, Danielle. So one of the other big questions many of you are probably asking are what funding opportunities are available. As Danielle mentioned, we intend to continue sequencing for at least 2 more years. So potential applicants of the EXO-1 sequencing opportunity should keep their eyes on a reissue of the 2019 EXO-1 funding opportunity, which is provided here. And these links and slides will be made available after the webinar. Currently, this is the only funding opportunity that actually uses Kids First funds, that $12.6 million we talked about at the beginning of the webinar. But we also have an NICHD-led R03, which we refer to as a Kids First R03 PAR. And this was recently reissued, and in the next slide I'll provide some updates. But researchers can also use other grant mechanisms, such as the Parent R01 or the Parent R03 to first data sets. Often a natural next step for these genetics projects is to validate variants through model organism work. So here we compiled a list of potential FOAs that might also be helpful. And while the Kids First Comp2 pilot that we started last year is no longer accepting proposals, we still encourage researchers to reach out to Comp2 program staff to pursue additional collaborations. We also strongly recommend that everyone sign up for the Kids First listserv, as this is our primary method of sharing relevant funding announcements, including short-term supplement opportunities that aren't listed here. And the Kids First listserv is also a good way to keep up with events and webinars. Here is a summary of the reissued Kids First R03 PAR. Like before, it follows the standard receipt date schedule with 3 application due dates per year, although the next receipt date will actually be next February because unfortunately the publication of this reissue was delayed, so we will have to miss this upcoming fall receipt date. One unique feature of the Kids First R03 PAR is that it has a higher budget cap than standard R03s, so applicants can request up to $100,000 per year in direct costs for 2 years. If you have any other questions about this, we encourage you to look at the FOA, but James Coulong is the primary contact, and then there are other scientific contacts from the other institutes that are participating in the FOA itself. The biggest update to this FOA is the detail of the data and resource sharing plan section. Briefly, it is expected that any tools data, workflows, pipelines that are created or used with support from that grant would be shared with the wider research community for sharing through the Kids First Data Resource Center in a timely manner and in a way that enables replicating or building on the analyses. These R03 grants must be used to analyze Kids First data sets, but if researchers are proposing to co-analyze Kids First data with other data, they must describe how those data are currently being shared. If those other data sets are not currently accessible through another data repository, they will have to confirm that the data can be shared, for example, through dbGaP. So we do encourage that anybody who's interested in applying to actually read the language of the FOA to understand this, and then you can obviously reach out to us for questions. But now I'm going to transition to the next part of today's webinar, which is to introduce a new community engagement effort called Kids First Second Chance. So the background for this is that we all recognize that the value of Kids First data sets will be amplified as more researchers use these data to make discoveries that will lead to improved health and ultimately alleviate suffering for families affected by childhood cancers and structural birth defects. There are many researchers accessing Kids First data. Keeping in mind, again, that the Data Resource Portal launched just 1 year ago, there are nearly 800 portal users, and the Kids First Data Access Committee reports that there are more than 70 approved data access requests for the 8 released genomic data sets. As discussed earlier in the presentation, there are several NIH grant mechanisms available to support analyses of Kids First data sets. But NIH resources are limited, and many excellent applications go unfunded. For example, with that Kids First R03 PAR that I talked about, this has been around since 2016. And in that time, the NIH has received, reviewed, and made funding decisions about 37 R03 applications, 11 of which were funded. Of the 26 that were not funded, 10 of them were discussed and received an impact score during peer review, but still missed tailings for the institutes that they were assigned to, because again, this doesn't come from Kids First funds, it comes from the participating institute funds. We anticipate that as more Kids First data sets become accessible to the research community, the number of research applications related to Kids First analyses will grow. As Charlene described, there are 8 data sets available now, but at least 25 more are in the pipeline. Meanwhile, another thing that emerged from the strategic replanning exercise that Danielle described is that external organizations are interested in working with the NIH to support pediatric research, and many patient foundations are strongly supportive of Kids First emphasis on data sharing and collaboration. So we've created a way that we think we can help connect organizations with researchers who are analyzing Kids First data, but were not successful in obtaining a grant from NIH. The way this would work is participating organizations would agree to be contacted by researchers seeking an additional chance for funding Kids First data. So agreements would be established by signing a Memorandum of Understanding between these organizations and the NIH, which explains the roles of each of us, NIH and organizations, in this effort. Meanwhile, researchers continue to apply for NIH grants to analyze Kids First data sets. For grants that are not funded, NIH program staff will help direct researchers to a web page listing organizations who've agreed to be contacted. It is then up to researchers to contact organizations and then provide summary statements from the original peer review and any other information requested by the organization to consider the proposal or even just part of the proposal for funding. From there, organizations would follow their normal procedures for receiving requests for funding, and researchers would follow their institution's procedures for applying for funds. We do ask that participating organizations commit their researchers to sharing data in a manner that is similar to the expectations of the Kids First R03. For example, Kids First R03 recipients are expected to be able to share data or pipelines that are created or used with support from those funds with this Kids First data resource. We can facilitate this by providing the language we use in our funding opportunity announcements and by sharing examples of acceptable data sharing plans, which we will make available on our FAQ page. And of course, the ultimate goal of this is that together we accelerate research and discovery and improve the lives of children and their families. This webinar today is essentially the launch of Kids First Second Chance. So in this phase, this early phase, we are welcoming participation from organizations who are interested in providing a second chance to Kids First researchers. The first step would be to email the Kids First mailbox, which is the same that Danielle mentioned, and then we can share an MOU template that outlines this agreement in more detail. Later this year, we will work with program staff across NIH to follow up with researchers who have applied for grants, such as the Kids First R03 to analyze Kids First data sets, but were unsuccessful, to make them aware of the list of organizations that the researchers can contact for a second chance. This week, we launched the webpage on the Common Fund, Kids First Common Fund website, where we explain Kids First Second Chance and where each participating organization will provide their contact information. So this is the webpage where we just describe what this is. And we already have had one organization sign on to participate, but we are certainly ready for more, and we are happy to answer any questions about this at any time. So with that closes out all of our presentations, and we will enter the Q&A period. Okay. I have a question about, I think this is for Sharon, so I will read it out loud. We have detected a very small group of patients with pediatric cancer and an apparent enrichment of other CNVs predisposing to neurodevelopmental disorder. Is it possible to collaborate with the group regarding this issue? I'm going to say yes, but I think Sharon.
Absolutely. Absolutely, yes. We would love that.
Sharon, I'm wondering if we can provide contact information for you.
Yeah, that would be great.
Or you can absolutely email, the person who asked that question can email the Kids First mailbox too. I'll put that up again, actually.
Okay.
Okay, one question we got a lot leading up to the webinar, and I'll go back to it, is how do I join the program? I do hope we answered that question, because the answer is you're in. Welcome to the program. You know, there's no carrying kids, Kids First community member. You know, again, it's a program where everyone can engage in a variety of ways. I do think that sometimes this question is actually about what funding opportunities are available, and we went over that. Again, right now, it's primarily the XO1 opportunity, and Sharon spoke a little bit about how that effort is helping her research. Again, as Vincent and Adam and Allison presented, anyone can log into the Kids First Data Resource Portal. Anybody who is interested in analyzing individual level sequence data will have to apply through dbGaP for the individual studies. And then before we close out today, we'll tell you about the only upcoming event we have in the next few months. Okay, another question. Do you have a list of common data elements required for samples submitted for future proposals? For example, samples from CNS tumors. I will start to answer this question, and I'll allow Adam and Allison to join in too if they can. So the Data Resource Center did come up with a really basic minimal list of data elements that we expect for incoming XO1 projects. That said, we really struggle with this because we have such a diversity of phenotypes represented in Kids First. And as you saw in the Cohort Builder tool, it's really important that we get as much deep phenotype data as possible to make these data sets as searchable and interoperable as possible. So we'd be happy to talk more about that. So we have a starting point, but when you apply for the XO1, we ask you to describe everything that's available. Will the PI be notified or consulted by the Access Committee when there is a request for data access? So that's a good question. This information is all entirely publicly available. So I'm actually going to jump to the bioproject page that Charlene described. This bioproject is just a way for us to keep all Kids First data sets together. And it's not super user-friendly, but if you click on this 8, this is the list of all Kids First genomic data sets that are available right now. When you go to this page, you will see the list of all of them. So let me jump to the Ewing Sarcoma Project. This is the individual dbGaP data access page for the Ewing Sarcoma Project. You can learn about the project in the description. And when you scroll down to the authorized data access request section, you can see all of the data access requests that have been approved by the Kids First Data Access Committee. So you can see which researchers are using the data set, and you can see how they are using the data set. This is all publicly available, very transparent, managed by the dbGaP data access request process. What is the expected timeline for dbGaP access permission? Any resources about preparing the required materials for the data access application? Why? I feel so prepared for this. This is great. I have a slide for this.
Oh my God.
So 1 year ago, when the data resource portal was launched, we had an all-day webinar, and we had lots of presentations that day, and all of those YouTube videos are still accessible. But one of them was our Kids First Data Access Committee Chair, Vivian Otto-Wong, gave a pretty detailed presentation on how to prepare a dbGaP data access request. There are also other materials available through NCBI resources, but this is definitely a great starting point. I don't know, timeline for permission. I think your question is, how long does it take for the DAC to approve an approval? I'll tell you that NIH-wide, we're supposed to say 2 weeks at most, but the Kids First Data Access Committee is so streamlined that they're down to 1 day. Can we have a copy of the slide deck and the presentation? Yes, the recording and all the slides will be made available. It could take us some time to process the recording to make it 508 compliant, but sign up for the listserv, and we'll make sure we notify everyone when it's up. Will you reply to the questions when we register the webinar? Yes, so we did ask for questions, registration. I'll say that last night I reviewed everything we had received until that point, and we had catered our presentations to address those questions. So if you registered after last night, we will have to follow up and just look at those questions, and we'll email you to answer any other questions, or please just ask them now again. Just making sure I didn't miss any other questions throughout today. I tried exploring the data portal. Absence of a single publicly accessible data set was a big obstacle. Could you explain your question a little bit further? Oh, no publicly available data set. Okay. Individual level data, individual level genomic data, according to NIH genomic data sharing policy, cannot be publicly available. Yeah. But I think this question is also referring to genomic summary results, things that, and so the portal has been live for 1 year. We are still developing the Kids First data resource and the various components of it. And I will say that on the horizon is a variant warehouse, the ability to search some summary statistics from the data sets that are within the Kids First environment. Adam, did you want to jump on that too?
Yeah, I can just add that, as Valerie mentioned, we're deploying additional environments for folks to use to explore summary statistics and additional data. We presented today one version of that, which is the PHC Bio portal, which allows you to at least review somatic alterations and non-sensitive data that you do not require dbGaP approval for, at least for cancer-based cohorts, as a first stab at providing access to such data. Some other data elements within Kids First cohorts and file types that do not represent individual based genomic data are available for you to explore right now. But as Valerie mentioned, most of the individual data right now that's there requires dbGaP access.
Thanks, Adam. Okay, I'm reviewing one more time for additional questions.
Hi, Valerie, it's Allison. We just had trouble muting. I did want to address the CDE question that was asked earlier a little bit.
Yes, go ahead.
I think you covered most of it, that, the kind of minimal set is not very, I think gratifying for research, but, we understand that there can definitely be limitations when people are collecting these specimens, especially retroactively. And so, that's kind of along the lines of demographics, diagnosis, phenotype, some of the fields that you saw Vincent demo. But we are really working hard with multiple different people to pilot ways of getting a more rich data that you might have been collecting in REDCap, even some folks who are interested in EHR level data. And I would like to also mention that it's not a one-time thing. You might, submit the data initially to get the specimens, but we've been really working with people about different tools and platforms that longitudinally, especially if there's follow-up data or other things that we can incorporate into the Data Resource Center. So alongside of Adam's comments about the open access data, that's also something that's on our roadmap for the next year.
And one of the things that I think we will be implementing as a feature in the platform moving forward, which I think will help also incentivize and support additional clinical phenotypic data collection, are more automated features of allowing users to know and understand when new data comes into the portal that aligns with their particular phenotypic interests. And actually, as you hopefully saw from our demonstration, the more phenotypic data you have, the more likely you are to be able to leverage additional data sets within the portal.
We have another question. I think, Allison, this is for you. Is there a way to know the size of the data files associated with the data set?
Yes, so if you go into the portal and in the file repository, as you browse and search, in the upper right, there will be a stat that will show you the different file sizes as you're filtering down. So when you first land there, it'll be the total file size. You select the things of interest, and it'll show you there. But again, I'll note, I think we acknowledge that download of the high-level files, the VCF, math files, you might want to do that locally. But again, in Cavatica, you can really bring the big data if you really want to do large-scale analysis without having to download as well.
The follow-up question to that was how much storage will be required for processing data locally?
What you want to do.
Adam, do you want to take that?
Yeah, I think if you want to do it locally, whole genome data is pretty large. It's part of why we've kind of created these cloud-based platforms across all of NIH, not just Kids First. I think there's multiple different cloud platforms now. So if you aren't experienced with the whole genome sequencing, the raw data really can be in the terabyte, petabyte level. Or if you just want the VCFs or maths, I think that is a much smaller data. But exactly, that's exactly what the portal is there for. You can go, you can search around and find what you want. Another thing that the DRC has been doing is really piloting cloud credits, and we have some new funding available to start doing that. We've had an initial batch of, I think, around 10 to 13 X01s, and we're going to be working on a good process to review that. Right now, it's pretty lightweight about the abstract, what you want to do, whether you want to bring your own data, and many of the different investigators have had pretty good successes of bringing their own pipelines to the data and more rapidly accelerating their analysis. But yeah, as someone who used to build very large computing systems, I understand that if you have one locally, there's definitely considerations there. And we can also help navigate that if you want to email us at support as well.
Yeah, and I just want to add to that, that point is something that also came up in the strategic planning exercise. And we are very programmatically interested in finding ways to make it easier and smoother to use these cloud-based resources, because you've shown very eloquently, everyone today, including Sharon, that that's how research is faster. Okay. Adam and Allison, before I do my last slide, do you guys have any last words? Or Sharon, did you want to comment on any of the questions or anything else?
Yes, Adam,
oh, go ahead, Adam.
As always, we always look for feedback from the community on how we can better serve you as a data resource center. So we're open to suggestions, comments, features. This is going to be an ongoing development context for the portal and environment. And so we're very, very eager to have community feedback as to the types of questions, features, or challenges you face as you engage the platforms.
Yeah, let me put that feedback slide back up. And again, we'll make this all available, but this is really, you can contact the Data Resource Center directly, you can contact the program directly, you can learn more about the program side and the Data Resource Center side. And with that, I will tell you about our upcoming event. It's only one for now. So we will be attending the American Society of Human Genetics meeting this year. We will be hosting an ancillary meeting, which means that people can come to it even if they're not registered to attend the main ASHG meeting. But we will be in Houston, so we're kind of traveling alongside this meeting. A lot of our researchers do attend ASHG, so this was the most logical place to visit this year. The theme of the poster session is accelerating pediatric genomics through research through collaboration. We've invited quite a lot of current collaborators like the COMP2 program and the INCLUDE program, and potential collaborators like NHLBI Stage, TopMed, St. Jude Cloud. These other large databases where we really have gotten feedback about potential opportunities for interoperability and working together. So that's the theme of that night, but of course it will also be about highlighting the research of all of our Kids First Exo-1 cohort investigators, and our sequencing centers, and then of course the Data Resource Center, who will be there with all of their experts and will be running demos of the different parts of the data resource like you saw today, but in more detail throughout that evening. I got another message that just says thank you. We always like that. We're trying faster. And with that, that's the end of our webinar. Please stay in touch, and thank you for joining. And again, all of these materials will be made available eventually. We will let you know through the listserv.
Thanks so much.